Some cancers are more common in children, okay? Mostly because, you know, the genetic makeup of these cancer cells are a little bit different. In the early years, children go to their pediatrician a lot, right? For vaccination, right? You go for injection. So during those visits, actually the pediatrician is doing a thorough examination. Sometimes, like for example, like cancer of the eye, right? We call it retinoblastoma. That's something a pediatrician can pick up in a regular visit. When they do your normal child examination, they'll sometimes look into the eye and check to see if the reflex is normal. Yeah, so that's something that certainly pediatricians can pick up, or your GP, whoever takes care of your child and gives vaccination to your child. The other thing is, sometimes it gets picked up from, say, if your child is sick and the doctor orders blood work. So some children, they get picked up that way. So they may not have symptoms, but then, you know, because the child is ill, the doctor does a blood test, and that's where they realize that, oh, why is the white count particularly high? Or, you know, platelet count is particularly low, but not to the extent where the child actually has bruises yet, you know. So those are some ways in which, like, if you do diligently go for your regular doctor visits, you bring your child for vaccination and all of that, then certainly, you know, some of these things can be picked up. Not to discount the fact that, you know, you bring your child only when the child is sick, right? That's also important, because if your child is ill for whatever reason and then you bring your child in to see the doctor, that's also a time where they can do the examination to figure out, okay, is this a common cold, say, is this a regular bronchiolitis or some lung infection, or is this something else? Yeah. So what is most important, I think, is that if your child is ill, don't disregard your child's symptom. If they tell you, "Mommy, I have tummy ache," right? And oftentimes I have parents who tell me, you know, actually my child's been telling me that, you know, she has tummy ache for a while now, you know, but I just ignored it. I thought she doesn't want to go to school, right? So try not to disregard some of these symptoms, and you know, bring your child to see the doctor and make sure that this is truly not something else causing the tummy ache. Of course, there are certainly children who say, I have a tummy ache because I don't want to go to school, right? They learn this, right? I have niece and nephew who learn that if they cough means, "Mommy, I cannot go to school, I'm coughing," you know, kind of things like that, yeah. When we think of the word cancer, we think of it as one disease, but actually cancer is multiple different diseases, and you know, the types of cancer that children have and adults have, they may have the same name, like you mentioned, leukemia. Adults get leukemia, children get leukemia, but the characteristics of these leukemia cells are a little bit different compared to adults. The way we treat children is also a little bit different compared to adults. And the major differences are that I always like to use this line, children are not little adults. So we can't have a one-size-fits-all treatment. We certainly cannot down extrapolate the treatment. So like, you know, adult, and then I just downsize the treatment to whatever the size of the child is, right? One of the few reasons we can't do that is because children are young. They don't have comorbidities like adults do. They don't have like the common diseases adults do, like high blood pressure, diabetes, you know, many years of environmental exposures. So they don't have all of these cumulative quote-unquote damage that's done to their organs, all right? So when we give treatment to children, it's tailored very differently than in adults. The other thing is also that children, the organs are generally very healthy. They're very young, okay? And children are very resilient. If we give them a treatment, their organs tolerate it much better, so they can recover much faster. To the surprise of a lot of people will tell me things like, "Oh, my child has cancer, you know, you're going to give chemotherapy. Can my child take the treatment? You know, they're so young, you know." To the surprise of a lot of parents, is that actually children tolerate it far better than adults.